Hi, Professor and classmates. My name is Christina Ressa, and I am going to be presenting my PowerPoint presentation to you all. Um, this has to do with the personality disorders, and I chose case study 1 that has to do with, that includes Jennifer. So let's get started. Jennifer is, she's recently divorced mother of 2 young boys. She has a few, issues that she basically went through when she was a child, such as her dad leaving her and her mother when she was young, so she has a fear of abandonment. She's in her mid 30s and she's very smart and successful. She holds a high level admin job, and so she is very she's doing well, as far as job wise. But due to her divorce, she has been seeking attention from multiple men. Um, and she's been dating online a lot. She enjoys meeting men, and she likes that they can provide her materialistic things, as well as stability. She writes in her diary that she will eventually find true love, no matter how many guys she must date. Her recent relationship has been actually very unstable. For example, Jennifer seems to be, her pattern is pushing men away that she gets really close to, and then she, when things become serious, and then when they go away and the relationship's over, she eventually wants them back. So it's kind of like a push and pull dynamic with her and her dating life. Jennifer's deep issues seem to be surfacing during this difficult time in her life. For instance, she was assaulted when she was in college by a football guy, and that seems to be affecting her relationships as well. She recently left her 2 sons with her ex-husband to go be with a boyfriend who lives across the country, but that did not work out, and she just got back recently, and she's feeling very depressed and actually suicidal. The diagnosis that I would consider Jennifer to have is borderline personality disorder. This fits Jennifer perfectly, more than any other diagnosis. The diagnosis with Jennifer is basically based on her behaviors and her symptoms, which include a consistent pattern of having unstable relationships, having behavior impulses, being emotionally unstable, and having a major fear of being abandoned. Most of these behaviors started when she was young, like I said, but then they just got worse and worse, and now she's in her 30s. So as a young adult till now, it's been increasing. The symptoms that mostly support BPD is a pattern of not only Jennifer having unstable relationships, but intense, serious relationships that occurs often. And for example, Jennifer's looks at men as a source of stability, either emotionally or financially, and she can easily become attached to these men that she dates. She shows this consistent pattern of these relationships, which is actually a clear symptom of BPD. Like I said, she pushes and pulls, and then she has a love and hate relationship with men. She'll start to lure them in after having things ended. The treatment course for borderline personality disorder in Jennifer's case, I would suggest that she should be it should be a consistent phase of an acute phase that promotes safety and stability, especially since she recently attempted suicide. This would consist of around 4 weeks. In this phase of treatment, Jennifer should be assessed often, basically almost every day or at least a few times a week. In addition, there should be a crisis safety plan, and she should see a psychiatrist to see if maybe she can take any medication. In addition to that safety plan, Jennifer should also begin a short-term treatment plan of around 12 weeks, which would consist of working on her emotional to get her to be emotional stable and work on her skill development. And let's see here. I think that Jennifer could learn to manage her urges to seek validation through those risky relationships, and I think that DBT, which is a dialectical behavioral therapy that works with patients with borderline personality disorder, I think that would help Jennifer drastically. In addition to Jennifer's treatment course, there should also be a long-term treatment plan that is about 6 months long, and this long-term plan should focus on not only the DBT skills, but also addressing patterns of instability, and promoting actually healthy coping skills instead of unhealthy coping skills, because we want her to learn how to manage her stress and her trauma in a healthy way. We want her to be healthy and independent. This consists of an individual therapy, group sessions, guidance from trauma-informed care, and trauma-focused therapy. The goal is to have Jennifer be emotionally stable, be a good mother, be stable for her boys, improve her attachment security, maintain healthy relationships not only with her dating life but family, friends, co-workers, and her ex possibly, just so that the boys can have a healthy upbringing. The cluster classification of BPD is cluster B. Jennifer's diagnosis of BPD is associated with all of the symptoms of cluster B. Cluster B disorders are described as very intense, emotional, dramatic, erratic, and these patterns of behavior, feeling, and thinking are all very intense. In addition to the cluster B, this focuses on, cluster B, there are borderline personality disorder, narcissistic personality disorder, histrionic and antisocial personality disorder, but the one that Jennifer, I would classify her, would be BPD, which is under cluster B. And the prognosis for Jennifer with BPD and possibly, I would say, comorbid depression, because she seems to, since she had that suicidal attempt, that is a sign of also depression. I would say that having a treatment plan that corrects both of these disorders would be ideal. Also, evidence-based interventions such as the DBT therapy can lead to an outcome of a major decline and decrease in BPD symptoms, and that will promote healthy relationships and improve her functioning in the long run, which that is the goal for Jennifer. That includes constant check-ins, close safety monitoring her, especially since she had that suicide attempt, and then frequent and consistent therapy sessions. We want to make sure she's not missing some, and then we want to make sure it's very consistent so that we are up to date with her, and we also want to make sure that she needs the psychiatric help and support that she may need, especially maybe she needs medication or whatnot, so we need to make sure she's on the right track with that. The prevalence of borderline personality disorder is typically common in women, so there's about, out of all the people that are diagnosed, 75% of them are women. BPD symptoms usually start to show in the late teens and up into the mid-20s. That's when people mostly start to experience them. And the risk factors of developing BPD include when a person experiences childhood trauma, and abandonment of poor caregiving from a parent, and maybe possibly genetic emotional instability. BPD is usually chronic, but evidence-based interventions can significantly reduce the symptoms. And that is what we want to do for Jennifer. Thank you.